Good morning, everyone, to the Monday, December 13th media briefing by the Windsor-Essex County Health Unit. We'll go right into the briefing and I'll pass it over to my colleagues.
So Mike, colleagues in the media, thank you so much for letting us share our comments today from the Public Health Service. As has been communicated previously, the Omicron variant is here in Ontario. We've not had a recognized case in Ontario as of today. I'll be meeting with the data team and we may get more information as the day progresses. One comment I'd like to share is we don't fully know the effects of Omicron, but I think that one thing that we can be reasonably confident about is that that if you are infected with Omicron, that you're more likely to transmit the illness to other people. And we have the general understanding that the disease is, for most people, is a mild to moderate illness, and that vaccination is effective at reducing the severity of illness. Stated another way, if you're vaccinated, you're less likely to be hospitalized, admitted to the ICU, or die. I think that the approach at this point in time, and I think that the most important approach, is to try to get as many people vaccinated, and that includes people, particularly includes people who aren't currently vaccinated, to get them vaccinated. And from a public health perspective, also to get third doses in those people that are currently eligible, as well as to keep continuing with our vaccination campaign for young people ages 5 to 11. It's likely we'll have other variants of other variants as we move forward, and I think we just have to manage this in a balanced and reasonable way. So I think Nicole is going to supplement my comments, and then go ahead, Nicole.
Sure. Just as everyone's aware, I think we've been hearing about it for some time, but today is officially the day. We really certainly urge everyone to, if they're eligible for their third dose, to go ahead and get that third dose. And as Dr. Desari said, if you haven't yet received your first or second, we are still accepting walk-ins for first and second doses as well at our mass vaccination site. And that's it.
Okay, we'll now go to questions. Again, due to time constraints, we're just taking 2 questions per media outlet. Today, we'll start with Blackburn.
Yes, I wanted to ask you if there is any update on the exposure notice at Bright Lights. How many cases have been connected with this? Do we know yet? Any new information about that?
So there is no cases connected. It's the Bright Lights exposure notifications, no different than other public exposure notifications that we put out, whether it's whenever there's a public setting and non-ability to identify everyone who potentially may have been exposed. It is outdoors, so it is considered a low risk exposure, and we just advise the individuals who might have attended at that date and time to monitor themselves for symptoms and certainly get tested if they develop symptoms. So.
The other question I had for you was about a resolution that's going before Kingsville Town Council tonight, asking the health unit to reconsider capacity limits on bars and restaurants. There is a feeling that they have been singled out because of the outbreak at the restaurant in Kingsville. Is the health unit, after meeting with town council and with some of the stakeholders out there, would the health unit consider changing it if warranted?
Well, go ahead.
Go ahead.
We constantly balance, we constantly evaluate public health direction and public health orders and make judgments as the time moves forward. Every tool that's available to control COVID-19 remains an option for the public health service. We know that dining events are high risk activities for the transmission of COVID-19. The outbreak related to the restaurant in Kingsville is just one of many dining events that are associated with it. I would, from my perspective, the capacity limits of 10 and 25, where 10 people are to meet indoors for social gatherings, is in parallel in many ways to the restrictions on restaurants. And I don't, and we're trying our very best to control COVID within the framework that we have, within the levers that we can pull to try to control COVID-19. We know that events like, without speaking specifically to the outbreak at the restaurant in Kingsville, we know outbreaks at restaurants travel to schools, and from schools, they also travel to other recreational events. The number one goal is to try to keep schools open for instruction. I know these are difficult questions, but we have to balance the different competing priorities, just like we do in households. And the question is always, is it more important to have a large meal at have a large people gather at a restaurant, or is it more important for one's child to go to school? Now, those are sort of bold trade-offs, but then in Windsor-Essex, our goal is to keep schools open, and if keeping schools open means that, or trying to keep schools open means that we have to articulate restrictions on dining at restaurants, I think that's a valid and fair trade-off that we have to make as a community.
Okay, thank you.
Thank you, Adele. Any questions from the Windsor Star?
Yes, good morning. Doctor, just to clarify something you said, I think you may have just misspoken. You mentioned that the Omicron variant hasn't been detected in Ontario. I think you meant to say it hasn't been detected in Windsor-Essex. Is that correct?
That's right. Thank you for catching that. And as you know, what we do is sometimes we stumble in our words. There are Omicron cases recognized in Ontario. We have not, I've not been advised of a case as of yet in Windsor-Essex. I think that day is coming. It's just a matter of time. It's likely at the end of the month that Omicron will be the dominant strain of COVID-19 in the province. So, but thank you for allowing that opportunity to clarify that.
No problem. Just want to make sure we get it right. And second of all, I'm possibly for Nicole. I'm just wondering if you have any comments on the demand for vaccine for 5 to 11s and also third doses. What's that looking like right now?
So our 5 to 11, you know, there was a good demand in the beginning. I would say it has slowed for us a little bit here locally as well. I think others across the province are experiencing that. So, you know, we're still working with our community and you know, with parents who maybe just are wanting to gather a little bit more information, but we are trying to ensure that we have spots available so those who are newly eligible in the 5 to 11 category can still, you know, quickly get an appointment. As far as our bookings in general, our mass vaccination site is very busy. And so both with, you know, certainly we're still seeing first and second doses at that site as well across our mobile sites, and then third doses, you know, we're seeing, you know, individuals come out with their third doses. So that's, you know, good news.
Thank you.
Thank you, Taylor. Now we'll move on to AM 800.
Doctor, I just want to make sure I have it right. So with the latest restrictions that went into place last Friday, like you stated, there are a number of goals and reasons why these restrictions were put in place. But the main, I guess the main goal here is to keep schools open. So I guess if you're a business owner, you're asking them to take that hit to keep the schools open. Is that accurate?
Yeah, I don't think that's the correct characterization. The first and most important thing is to protect the health of the community. So anytime you effectuate a public health order, you're trying to protect one is trying to protect the health of the community. Secondly, we know that there were approximately, and we can give you the exact number, there were approximately 45 deaths since August in Windsor-Essex. 2/3 of those deaths were in people that were unvaccinated. Many of those deaths were senseless losses of life. They were senseless losses of life. People who had many, many more years to live had died of COVID. That's among the unvaccinated. Among the vaccinated people, many of them had chronic illnesses. Some were in the twilight of their life, but many had many more years to live, save for the fact that they were infected by COVID. So I'll give you just an example of a hypothetical example. You have a man in his 70s who has lymphoma or has a treatable cancer could live many years. He gets COVID and he dies, despite the fact that he's vaccinated, because those people with chronic illnesses can't mount an effective response. So we've had many, many deaths in Windsor-Essex related to COVID. The way to manage a communicable disease like COVID is to break the chain of transmission. And breaking the chain of transmission means that you have to reduce the number of people who are currently infected. That's one approach to it. So for a school, we know that we have dismissed about 800 cohorts of young people since the beginning of the school year. That's 16,000 children. 16,000 children. And a good number of those penetrations into school have been penetrations from people who are currently infected in the community who introduce it to school communities. Now, so to the extent that we can reduce background risk, reduce the number of people who have COVID in the community, that will reduce the number of exposures in schools, and that will decrease the number of cohorts, or try to effectuate the number of cohorts that are affected by COVID. Now, why do we want to why do we want to try to control outbreaks in schools or exposures in schools? Well, once there's an exposure in school and it affects 20 young people, we want to make sure it doesn't affect the entire school, and that's why the young people are dismissed. But the real goal of trying to control COVID in schools is to prevent the chain of transmission. And from the young person in the school to another young person into the school, into their mom and dad, and from their mom and dad into a grandparent, and then from a grandparent who might make a visit to a long-term care facility, or who might interact with someone who is vulnerable from a health status point of view, and then they get COVID and they get hospitalized and may die. So that's the reason we've effectuated these group of orders. The one other thing, and I think this is a moral case we all have to articulate, thousands of young people are being disrupted from school so that they can protect primarily, but not disproportionately, a group of people who are unvaccinated and choose not to get vaccinated. So we're inconveniencing little children, depriving them of school, thousands of them, so that we can make sure COVID doesn't make its way into affecting an unvaccinated group of people, for the most part. And I think that's the case that we have to think about. So in the Public Health Service, we have this mandate to try to protect the health of the community. And that's what the statute requires us to do. And we're just trying to use the best possible judgment to effectuate that plan. I'm sorry for that long-winded response, but my apologies for that.
No, I appreciate that. Thank you. And Nicole, one quick one for you. I'm not sure if you have this Monday morning question, but with the new restrictions that went in place on Friday, how did everything go over the weekend with your team?
Yeah, so I can't speak for Bylaw or police, what they saw, but our team was out as they are every weekend, Fridays and Saturday nights. We do have enforcement officers out all day and all night. Overall, I think things went pretty well. Again, as I've said before, our first goal always, especially when there's changes in any kind of direction, is to ensure that we're educating. We may provide a lot of sort of notices of violation, as we call them, which is if we're seeing something, that's not correct, we'll work with businesses to educate, ensure that they understand the changes in the rules that apply to them. So certainly a lot of education occurred over the weekend. There were, several charges as well. Mostly, again, this isn't anything new. We continue to see challenges with compliance related to masking and adherence to personal protective equipment, which is really important. I know Dr. Necessary spoke at length about some of these measures and why they're important, but really, some of the highest risk activity is that close. We've been saying this for 2 years. It's that activity within 2 meters. It's unprotected. You're not wearing a mask. So certainly in businesses like a restaurant where people are in close proximity to each other, unprotected, is a very, very high risk setting. So we do a lot of education to ensure that they're making sure that those distances between social gatherings or tables are there, and making sure that both the workers and the individuals are protected and they're adhering to all of the rules. But yeah, they were out, they were busy, but I think it was a good weekend, lots of education.
Thank you.
Thank you, Rob. Any
If-
questions? Oh, sorry,
Mike,
go ahead, Nicole.
Sorry, I guess if I could just add maybe while we are speaking to some of the confusion, and I know we're going to put out some messages this week to all businesses just to ensure that there is, no confusion and that individuals really do understand what the letter of instruction asks for. So just as we noted, we've asked workplaces not to have holiday gatherings. So those are prohibited under the letter of instruction. So it doesn't really matter where they occur, whether they're in the workplace or in a restaurant. Workplace gatherings are prohibited. We ask that workplaces really, have those virtual as well. Social gatherings are no more than 10 people. So again, if it's at a restaurant or anywhere else, it's 10 people. So we really shouldn't be seeing a gathering or table for more than 10 people. So those were, I think, some of the confusion that I know our officers saw this week, and we'll be seeking to clarify with businesses, but as well as with the community this week.
Thank you, Nicole. Any questions from CTV?
Yes, good morning. Now, I know you don't comment specifically on cases at local establishments unless there is a risk to the public. There was a video circulating online last week with maskless patrons at a local restaurant and bar. And I'm just wondering if there is any concern for the more general public and if you have any information at all that you could possibly share on this.
So anytime that we have a case and there's a public exposure and we're not able to identify all of those individuals who might have been exposed, we will put out a public exposure notification. We, again, from a compliance perspective, we are out. We can't really, over the course of the pandemic, we have received videos and appreciate those complaints. We do follow up on all of them. We can't act on information that but we will follow up. And so we're acting in that way. And then our officers, it's up to what they observe, certainly when they're out. But that's about all I can share other than, we do follow up on everything that and every complaint we receive, any video that we might receive, we will, if we can, follow up with those businesses. And any business that finds out of compliance, we will follow up with them more frequently to ensure that whatever instruction or direction or education we've provided, that it is being adhered to.
Okay, thank you. Now, you have talked a lot about keeping schools open, and I think a lot of Windsor-Essex parents are wondering what's going to happen after the Christmas break, the holiday break. What are your thoughts on if children should go back to the classroom or if there's a chance that online learning will resume after the holiday break?
Well, I don't think any one of us can predict the future. And so it's hard to know, it's hard to make predictions of that nature. I think that the general goal is to try to reduce human-to-human interaction and to minimize exposure from people that are infected to those that are uninfected. I think that as a matter of public health policy, we would be reluctant to recommend school closures and would recommend other actions before we got to that point. The goal is to try to break chain of transmission. If at some point in time there has to be a change in format in education, I know my colleagues at the school board will do everything they can to provide the best possible instruction, no matter what the format might be. I do think the number one approach, though, is to try to reduce the number of cases in the community. And if we can keep the case counts under control and improve vaccination rates, that'll only favor the approach of trying to keep schools open for instruction.
Okay, thank you.
Thank you, Melanie. Any questions from CBC?
Yes, good morning. The border to the United States has been open for some time now without as much restrictions. Any sense that that may have had an impact on the cases we're seeing locally now?
Well, the policy and the evaluation of border traffic is a federal is a federal direction or federal initiative, and I would ask that you ask that question to federal authorities.
But local data, I mean, would we have any indication that cases are being transmitted from across the border?
Nicole, I don't think we have any evidence. Well, maybe you could comment on that, but go ahead, Nicole.
So that would be considered travel acquired. And so we do report every day on our cases, and those that are considered community acquired, which, those are a result of close contact, whether they're household or friends, and then those that are travel related. So that information, is available and reported daily. So, so where there was a case associated with travel, so anything outside of Canada, or would be considered travel related. Couldn't give more details other than that.
Thank you. And just wanted to follow up with the rapid tests being sent home from students. Any updates there? Are the tests still going out to students at home, and any back?
So there's no back. That's a provincial strategy. It's not through the public. We'll go home with all students for use over the holidays. We are working with our school boards to ensure that residents and individuals understand how they are to be used, and as well if an individual gets a positive result, what their next steps are. So that's something we'll work with the school boards on, but that's a provincial strategy. So we don't receive data as it relates to rapid antigen tests. We only receive information once someone has a confirmed positive through a PCR assessment center.
I guess we'll conclude here, and then we'll see everyone on Wednesday.
All right. Well, all the best.
Thank you.
Thank you.